This presentation, entitled Performing Clinical Research Projects to Validate Evidence-Based Practice, was composed by Bob Demers. In this, the age of evidence-based medicine, we're constantly urged to base our respiratory care practice on solid evidence, in lieu of the mere opinions of various thought leaders. But a colleague of mine recently complained about the scarcity of evidence upon which we might base our practice. Is this a valid complaint? And if so, how might we remedy this situation? In this module, we examine research projects that have been described in the peer-reviewed literature that furnish a solid basis for some of the elements of our practice. Consider, for example, one of the earliest examples of evidence-based practice, the Allen's test. We all were taught the details of the Allen's test when we attended RT school, but it was forcefully demonstrated to me and my colleagues that more often than not, the results of this test are documented improperly, which places patients at considerable risk. Specific steps that we can implement in our own institutions and departments are enumerated, the application of which will serve to involve us personally in the active promotion of evidence-based practice. The members of ICU teams are surrounded by a host of electronic monitors, some of which supply us with the same physiologic indices. For example, we're all familiar with pulse oximeters, marvelous instruments that display the saturation of arterial blood continuously and in real time. Point-of-care analyzers also furnish that same parameter to clinicians whenever an arterial blood gas or ABG analysis is performed. One of our colleagues noticed that the saturation value provided by these two instruments varied by more than 4% for a patient under his care, and was unsure which of the two instruments was intrinsically more reliable. Which readout would you be inclined to prefer? In this 59-minute presentation, and only here, you'll be provided with incontrovertible evidence of the relative accuracy and precision of the point-of-care analyzer vis-a-vis the pulse oximeter. Typically, RCPs perform percutaneous radial artery puncture for the purpose of obtaining blood samples for subsequent ABG analysis. On occasion, a physician colleague might want to determine in vivo ABG data, as might be relevant for a patient undergoing cardiopulmonary bypass or therapeutic hypothermia. If you were called upon to generate such data, what alternatives are available to you? This presentation describes two approaches to this task: an analyzer-based algorithm and a web-accessible computer application or app. The app provides clinicians with in vivo and in vitro ABG results side by side. Navigating through this presentation will not only enable you to identify specific peer-reviewed monographs that furnish compelling clinical evidence upon which to base your practice, it will also suggest activities in which your department can participate to enhance the reliability of the data that serves as the basis of our collective clinical decisions.